Hello, and thank you for the invitation to let me talk. So I'm going to be talking today about some of my ongoing research on asthma, as well as a new angle that I've been studying. For the past 6 years or so, I have been doing research on asthma. And I'm very interested in green space in general, so I've integrated that into my asthma research. My overall objective here is to quantify the total risks and benefits from urban green space on asthma incidence, exacerbation, and disparities. There are all these different aspects of asthma that can be impacted. And with an understanding that there may be risks, both risks and benefits from green space, to estimate net effects of green space. That's my overall goal. I haven't actually achieved that yet. So I have a series of studies examining possible risks and benefits from different angles. So as some background, I'm very interested in urban green space. As we know, the world is rapidly urbanizing. Since the early 2000s, urban populations have exceeded rural populations, and it just continues to grow. And so there are a lot of asthma risk factors that are increased with urbanization. A lot of the things that we've talked about today, increased air pollution, extreme heat, especially in urban environments, flooding and molds, substandard housing, and respiratory infections from crowding in urban settings. So these are risk factors for asthma, and one of the mitigation strategies has been to plant trees and other vegetation in urban settings. There are a lot of groups in Philadelphia who are involved in greening. These are some of the groups here: PHS Tree Tenders, which we talked about earlier, Philadelphia Water Department, and a lot of different types of green space, maintaining natural areas like the Wissahickon Park in Philadelphia, then more urban parks and trails, such as those that we have in Center City, street tree plantings, private yards, which can be very important as well for individuals, urban agricultures, vacant lots, and green stormwater infrastructure from the water department as well. And, so even in a very urban setting, we can have nice green spaces which can impact our health in different ways. There are definitely unequal availability of green space and greenness in general across Philadelphia neighborhoods, not to mention the suburbs. But you can see here, this is a plot from my colleague Leah Shinazi showing greenness values, or what's called the normalized difference vegetation index in Philadelphia census tracts. And of course, the Northwest near Chestnut Hill and the Northeast of Philadelphia have very green neighborhoods, and a lot less green in Center City, South Philly, even, spanning very poor neighborhoods, and even some of the more affluent neighborhoods like Society Hill have very low amounts of green space. So as a conceptual model for how green space can impact asthma, in most of my research, I have been, studying green space exposures, like total green land cover, qualities of green space, use of green space, and in relation to different asthma outcomes, like asthma exacerbation, or actually now I'm studying incidence or new diagnosis of asthma. But there are all these different mechanisms of effect or pathways by which these effects may be occurring. It's try to get at some of this in my research, but it's much harder to tease out what those mechanisms might be. But some of the mechanisms that are widely discussed are with green space reducing harms, such as by capturing air pollution particulates, for example, decreasing noise, cooling areas, decreasing temperature, decreasing stormwater runoff. Another aspect could be by green space restoring capacities of people, such as mental restoration, decreasing stress, and preventing asthma that way. And then finally, green space may be helping people build capacities, such as by increasing opportunities for physical activity, increasing social interaction, and thereby building capacities that will help with health. Okay, But as I mentioned lately, I have been studying incidence, and that's mostly what I'm going to be talking about coming up. There is another pathway that is thought to affect incidence, and it may impact exacerbation as well. But that is by green space, vegetation, providing a setting in which people come into contact with beneficial microbes. And this is thought to be important, especially during infancy and early life. So when children are born, there's number one in the corner there. The immune system is naive. There has been almost no input to develop memory cells, antibodies. The early months and days of life, even in utero, number two, there's data that goes in to the infant. And exposure to a wide variety of organisms, including both harmful pathogens as well as what are called microbial old friends, are thought to really impact the development of the immune system. And so these old friends are exposures that we had when we co-evolved with these types of exposures in organisms, certainly a lot more contact with animals, such as on farm settings, different helminths, which we may have been exposed to in drinking water during evolution, microbiota of other people, such as in living in group settings, and also microbiota from the environment, which is what I'm thinking about with regards to green space. So with those kinds of exposures, the theory is that there's a wide range of memory cells that are developed, including memory cells to indicate, this is actually not a pathogen. This is not something that I need to react to strongly. And so with this healthy development of the immune system, the body sets up a regulation system where it knows that it must not attack its own cells, which is the basis of autoimmune diseases. It doesn't need to, create inflammatory processes to these harmless things that we co-evolved with. So a very small subset of that is this exposure to microbes from green space. And so this is a subset of this is called the biodiversity hypothesis, that the decline in biodiversity exposure, particularly in early life, has led to microbial deprivation of infants. And this leads to a microbial imbalance in the gut and sort of like disrupted immune development and a higher risk of inflammatory diseases. And I will stress that this is just, it's only one of these mechanisms, but it is a mechanism of interest, particularly for early life, which is what I'm looking at in this study. So, so we have the biodiversity hypothesis. There is a counter hypothesis to this, that there may actually be increased risk of developing asthma and allergy if you do have greater green space exposure during infancy and childhood. Because clearly allergens like pollen do trigger allergic reactions. And if you're exposed to pollen, you can actually become sensitized to that allergen. So then a question is, does more green space exposure actually cause development of asthma and allergy? And there's really no clear answer to this yet in the literature, but there are actually some data to support this counter hypothesis, including a study that was done by Gina Lovasi at our school in New York City, where she did find with more street trees, the kids had an increased risk of developing asthma. So I'm really curious to find out in my study what the answer was going to be. So this is an ongoing study I have on urban green space and whether it influences the initial development of asthma. The specific aims are listed here. The overall question of looking at the association between residential green space and asthma incidence from infancy through childhood. And then the second aim is to look at modification of the relationship by urban factors such as air pollution, traffic, urbanicity, which is really population density, and different socio-demographic factors. And then third, to describe the heterogeneity of the association among different asthma phenotypes, such as asthma that has an allergic component versus asthma that doesn't have any allergic features. Okay, so the design of this is using electronic health records from Children's Hospital of Philadelphia, CHOP, primary care. So we, in a sense, developed a birth cohort. It's really an infant cohort of over 190,000 children who were seen for the first time in CHOP primary care at less than 6 months of age, and that they had visits beyond 6 months of age in primary care also. So this data is from 2005 to 2021. So there is, sort of a maximum age that they could have reached, and that's 12 years old. It encompasses the Philadelphia, Camden, Vineland combined statistical area. So it's essentially a Philadelphia metropolitan region that includes parts of New Jersey, Delaware, Maryland, and so forth. And so in this study, we have patient addresses at the time of each visit. And so we have linked green space measures and other neighborhood measures to the patient address, throughout their childhood as they were seen, and developed a number of different green space measures for this study, including overall greenness, or this NDVI measure, which is from satellite imagery, tree canopy coverage. This is very high resolution, grass and herbaceous land cover, a measure of land cover diversity, vegetated land cover diversity. How many, did they have a mix of grasses, trees, and herbs, or was it, just all one kind? Parkland, green stormwater infrastructure, different spatial patch metrics, such as, the size of green spaces near people's houses, and also using the street tree database from the city of Philadelphia. Okay. So essentially, we've seen other diagrams like this today, but as I mentioned, the land cover data that we're using is very high resolution, so that's very nice. I can't remember exactly where it comes out of, University of Vermont, but anyway, so that's very high resolution land cover, and we are summarizing that data within different areas, sized areas around people's homes. So part of my interest is in not only seeing, the impact of green space on asthma, but it doesn't matter if it's very green within 50 meters or, within 2,000 meters. Is that good enough? Okay. So just some very preliminary data, just a little bit. So for the statistical analysis of our basic question, does green space exposure prevent development of asthma during childhood? I'm looking at early life exposure, that's before 1 year of age, or sorry, 1 year after birth, and then cumulative exposure through follow-up. So 2 different kinds of exposure measures. And also looking at asthma incidence during follow-up at different ages of follow-up, age 2 years, age 5 years, age 10 years. And for incident asthma, I'm saying that they had to have 2 diagnosis codes for asthma, and they had to occur at least 6 months apart when they're followed from infancy. And then estimating the relative risk for that association using, within the cohort, using Poisson regression with robust standard errors. Okay. So these are some of my initial results. Tree canopy coverage within 500 meters of the residents was inversely associated with asthma incidence, but mostly at ages 5 and 10 of follow-up. These are different quintiles of tree canopy coverage exposure. So this is more tree canopy coverage near the home, and there's a lower relative risk below 1. With more tree canopy coverage, but you really don't see that association for asthma incidence at a very young age. And there were similar associations for early life exposure and cumulative exposure. I haven't quite teased that out yet. So that's tree canopy coverage. And we did have the hypothesis that out of different kinds of vegetation, trees would be particularly beneficial. So this is nice to see that that's fitting our hypothesis. So we also wanted to look at, non-tree vegetation. And I don't show it here, but what we mostly see with non-tree vegetation like grasses is that it's mostly associated with increased risk of asthma. And then we also looked at what I call total vegetation coverage, which is, tree cover and also non-tree cover of vegetation within 500 meters of the home. And it was, kind of associated with some decreased risk for the older ages, but associated with increased risk of these asthma diagnoses among very young children by age 2. So still teasing this out, but it does seem to indicate that, certain types of vegetation particularly may cause symptoms at these very young ages. What I need to do is to go back in and see for the children diagnosed at these ages and this association, does asthma resolve after a certain amount of time, or is it persistent asthma? That would be interesting. Okay, and so future research directions. This is not so much future, but I do have PRCCEH pilot funding through November of this year to examine in this same cohort the role of extreme weather events during early life and childhood on whether that impacts development of asthma, and also looking at allergies within this cohort. So looking at, the extreme weather events that you would think, extreme heat waves, heavy precipitation, intense rainstorms, as we know, all of these things really work together. So including extreme weather events in these models to see whether that impacts the risk at all. While accounting for the other variables that I'm already looking at, like green space and sociodemographics. And then ultimately, I would like to keep looking at this topic. I think, there are things that can be done to make it better. First of all, really not only looking at asthma diagnosis, but looking at complex symptoms and also trajectories. As I mentioned, some of these asthma cases do resolve over time and people don't have asthma when they're an adult. So we do also need better ways to profile cases, since asthma is very heterogeneous. Factoring in information on sensitization to specific allergens. Unfortunately, in the data that I'm working with, a very small number of the kids actually get allergy testing. So it's not possible to get comprehensive information on that. And then factoring in vegetation assessments that include more characteristics of green space rather than just, coverage and size, but also things like, well, these are the things that we're mostly looking at now, but also factoring in things like allergenic species, biodiversity. Some of these things actually require on the ground assessments and data collection. For example, even with samples to look at microbes in somebody's immediate green space area that they use. That would be interesting for this question as well. Okay, and thank you. And this is me, I'm a tree tender. So if you have any questions.